So hello there everybody, my name is Nath Arwa, your antibiotic steward, your antimicrobial steward, and I would like to talk briefly about the topic, be an antibiotic guardian. Now first of all, I would like to respond to the question, why are antibiotics important? Now without effective antibiotics, many routine operations would prove impossible or dangerous. These include surgeries involving hip replacement, organ transplant, cesarean section in the female population, treatment of sepsis in the ICU, in the HDU and the medical wards, or cancer chemotherapy. Now this would become more and more dangerous to perform without antibiotics at our disposal. In all these scenarios, antibiotics prevent or treat bacterial infections whose consequences can be far-reaching. Now next, I would like to comment about the fact that antibiotics pose a risk to us if overused or misused, especially in viral infections such as most upper respiratory tract infections or the self-limiting bacterial infections that we incur in daily life. Now, overuse of antibiotics that are very precious agents can lead to the emergence or development of drug-resistant bacteria. Now, managing such infections may require more toxic and costly antibiotics. Now, when drug-resistant bacteria cause infection, they may be serious. They may not respond to what we have in our usual arsenal. Now, such infections can be difficult to treat. They may require second and third line antibiotics that, as I've said earlier, are more expensive and tend to be more toxic than the first line antibiotics. So let's not get there. Let's avoid them when we can. So next, I would like to answer the question, are antibiotics safe? Now, despite the fact that antibiotics treat bacterial infections, they have a number of unwanted effects which can negatively impact clinical or treatment outcomes. Now, this may include rashes, especially when we use penicillins and cephalosporins. It can also include thrush, oral thrush or vaginal thrush when we use our popular drug co-amoxiclav or augmentin. Can also end up with stomach pains, can end up with diarrhea, which is also common when co-amoxiclav is prescribed. We can end up with reaction to sunlight. This is commonly encountered when we use drugs from the group tetracycline, and we can have other symptoms as well. As healthcare providers, we need to educate patients on the possibility of these unwanted effects occurring, especially during treatment, and should advise them on what steps to take when these reactions occur. Now next, I would like to briefly discuss which way forward now that we know that antibiotics, if used inappropriately, can cause harm. You and I have no option but to ensure antibiotics are used appropriately in the case of bacterial infections alone, not in viral infections. Now, Let's help conserve antibiotics so that they remain viable, so that they remain effective in infections where they're indicated. Remember, antibiotics are not renewable. They are a finite resource, and they can be rendered ineffective or useless through irresponsible use, especially when the bacteria become resistant to them. Now, your actions and mine can protect antibiotics. Whether you are a healthcare provider or a patient or a caregiver, you have a responsibility. Please, please, please use antibiotics judiciously for a better tomorrow. Finally, my dear listeners, I would like to thank you, even as I urge you all to be guardians, to take full responsibility. It is a huge battle. Microbes are outsmarting us, and antimicrobial resistance, AMR, is an issue we can't ignore or wish away. Now, if this video helped you in any way, make sure you give it a thumbs up, and do not forget to subscribe to my YouTube channel. The best is yet to come. Thank you very much for watching, and have great antimicrobial stewarding. Thank you.